Brilliant, thanks very much. I was told off because last time I ran over by about 15 minutes and I only got 5 minutes. I don't do anything in 5 minutes, except see about 4 patients. Anyway, I'm Jim Heath. I've been a GP in Nosey for 27 years. And no matter what you think about Liverpool, we beat your hands down for every horrible illness demographic you can think of. So, and when you've been a GP for so long, you realise that you're really impotent. There's very little you have to do to change health in any meaningful way. So obviously we have to look at other ways of doing things. So we have a look at, let's have a reality check. Let's have a look where we are today and see the size of the problem. I mean, this is it. 9,500 children living in poverty in Knowsley. Life expectancy 3 years less than the rest of the UK, but you have 6 years of ill health before you die, so that's 3 years more than the rest of the UK. 23% of children are obese. It's got the poorest educational record if you're judging it by GCSE standards in the country, and one of the lowest spends on education as well. It's got one of the lowest percentage of physically active adults, under 18 conceptions, are 50% higher in the UK. Need I go on? Alcohol-specific stays are higher, smoking at conception and it's higher, breastfeeding is one of the lowest, etc. So it's not very good, is it? I've been a GP for 27 years and made no impact whatsoever. It's quite difficult with GPs because everyone knows what GPs are like. I know what they're arrogant. And it's very hard to engage with GPs, and you see very few of them at events like this. It's like the old joke, what's the difference between God and a doctor? Well, God knows he's not a doctor. So how do we stop these kids becoming this guy? He's a nice guy, everyone likes him. But if you look at things like the ill health we're talking about, long-term conditions we're talking about, these are lifestyle issues. It's nothing new to us. We know that smoking, drinking, lack of exercise, poor diet causes most of the illnesses our patients suffer from and continue to suffer from far longer than the rest of the UK. And the key to this is primary prevention. A lot of people will talk a lot, and a lot of vets put into, once you've got the illness, what are we going to do about it? Right, we'll put these nurses in, we'll put this support in. It's too late, they've got it. They're on the conveyor belt to dying early. We've got to push it back a bit, stop the bodies being thrown in upstream, and that's a really difficult task. If you look at things just to depress you even more, so he's in the pub, he's having a drink, he's one of the lads, he's great, isn't he? Then he gets told he's got lung cancer, and all of a sudden life isn't so bright, and he's only 45. So in Knowsley, there's one smoking-related death a day, which is nothing to be proud of. Lung cancer figures are ridiculous, in some areas nearly 3 times the national average. And there's a big variation, like there is in Liverpool, between different wards. And there's nothing sadder when you're a GP than you send someone off for an X-ray, they come back, they sort of know there's something wrong because they lost a bit of weight, and traditionally in Nosey and Liverpool, people present late with cancers and things, and you've got to tell them what they already know, which is they've got lung cancer. And the saddest thing is, apart from when you're saying that they already know that and they look through you and not at you, because they're completely detached at this point, is that they all stop smoking. Every single one of them. No one continues smoking once you've had that diagnosis. Well, can we do it a bit earlier? So there's some good news. Life expectancy in those years is increasing, but so it is also in England. So the gap isn't closing, so we can't take the credit for people living longer, because it's obviously a national thing that's happening. Unfortunately, one of the areas we're not doing so well in is the prevalence of diabetes, which is rising year on year, which of course is related to obesity. So as not to get too complacent, I took a selfie this morning just to see where it sat on the diabetic spectrum, and I think you can see I'm in good shape. I'll let you linger on that. So, what do we do about it? difficult. You had to do something. You couldn't just sit there, you know, in the twilight of my career and say, oh, that's it, I've done a good job. Because really, you know, if you can, you've got to try and make a difference. And of course, in health, we haven't engaged with IT at all, really, not in any meaningful way. There's lots of apps around, and it's always the connected people who use apps. So what do we do? Well, the first thing we did was have a look in the waiting room. We spoke to patients. We got involved in the digital inclusion group in Nosy to see what actually people were doing. And of course, you look in any waiting room, and everyone's on a mobile device. In the background is a TV on with all sorts of terrible public health messages that no one can understand. But also, we understood that you can't make change by imposing change on people. People will only change if there's a reason to change and alter their behaviour, and if it's meaningful to them in their life situation. So we have to facilitate that. So what we designed in Prescott with the help of Serco Moore as a UX designer, all at our own cost, all unfunded, and it's out the GP's pockets at the end of the day, was an app which we didn't just want to develop an app, but we lobbied the CCG so that we could have free public access Wi-Fi in all GP surgeries, which still isn't there, but we're getting there, along with the development of the app. So what you see, you're not told by your GP, there you go, you're fat, go and do that, and that'll be great. Although sometimes you do say that to people. What you see is, right, you go into your surgery, you download the free Wi-Fi, you answer the friends and family test if you want, we make it sticky, so you download, say, the Nosy Health app, the Liverpool Health app, and that's a platform on which other apps can be put. And within that, you can make your own avatar, you can say what your goals are in terms of weight, exercise, whatever, and if you don't achieve those sort of goals, then it'll just give you a gentle reminder, give you local support, and the message, it always has to be in language that people understand. It always has to be relevant to their life where they are, to their education, socio-culturally, because most apps do not engage with people in, say, the lower socioeconomic groups, people who can't read and write too well. I've never met anyone who drinks a lot, who doesn't want to stop drinking. Never met anyone who smokes, who really wants to smoke. So why don't they do it? We're pushing against an open door, but we don't seem to be able to manage this well, certainly in primary care. So basically, we've made a message to patients, which is, it's fun, contemporary, use gamification methods, and I'll have to shorten this because I'm probably on about 7 minutes now. And because mobile devices are ubiquitous, even in Nosy, nearly 90% of people have access to a mobile device. And people access a mobile device on average 1,500 times a day if they're on Facebook and things like that, and if they access their emails. It's the way people connect with the world, and the friends, and the family, and it's the way that it's their channel of communication now. We have to communicate with them. And so this is our part into trying to stop the public health disaster that's unfolding, to try and alter behaviour from grassroots. Thank you.